Excellent question. I'm so mad at myself that I haven't already addressed this because it is a word that I use quite frequently, but the word is, how do I define quality movement, or what does that word mean? So the question is, how do you define quality movement in stroke patients? Often my movement, especially with new movements, doesn't feel great, not to mention movements I've been doing for years. Hope that makes sense. So yes, that absolutely makes sense. And like I said, it's a word that I use all the time and I've never really explained. So I want to kind of clear up some definitions first. So I think when I started using quality movement is when our profession, physical therapy profession, especially in the world of neuro, started to shift a little bit. And what I call, we shifted from quality movement to quantity movement. So what kind of happened in the profession is, instead of spending a lot of time after a stroke or a brain injury really working on facilitating normal movement patterns that had been lost due to damage to the brain, which is kind of one camp of thinking, we shifted all the way to the other side, where our profession decided that working on quality movement wasn't producing enough data or goals to present to insurance companies, is what I think, to show that there was progress. So there was no way to measure that facilitating normal movement patterns had any clinically significant benefit to a patient that had had neurologic injury. And so what I meant by quantity movement is the profession kind of shifted to, instead of making sure someone's movement looked normal, it was better just to make sure patients could walk really fast, walk really far, because those were measurable goals that I think they could present to insurance companies to show progress. And so that's really where our profession lies now, is it's all about just make sure someone can do everything independently and walk really long distances and walk fast, and it doesn't matter what it looks like. And so I am more in the other camp of focused on quality movement. One, because I've seen the ramifications if you don't work on that, like years down the road, where you start to have injuries and pain due to these compensatory patterns, as well as the fact I've found that a lot of patients really value it. They like having things to work on. They don't like things feeling abnormal. So when I'm talking about quality movement, I'm talking about not just making sure you can do something functionally to be independent, but also to try and normalize that movement pattern so that it looks as similar or close to as similar as the other side. Now, there's a couple other terms that I think are important since we're on this topic, and one is normalized movement versus efficient movement. These are two other terms that I think are pretty important to understand. And when I use the word normal or normalize a movement pattern, what I mean is I'm comparing it to your other side. So if you wanted to do this on yourself, and I tell my patients to do this when I give them exercises, is do it on your uninvolved side first, and then try and make the other side or the involved side look as similar as possible. That is when we're working on a goal of normalizing movement patterns. Now, there's also efficient movement, and outside the neuro world, these two might align pretty closely, that a normal movement pattern would also be efficient. Now, the reason I think it's important to talk about this, especially when it comes to this question in particular, is that after a stroke or a brain injury, there's a lot of reasons why you can't normalize a movement pattern. A lot of barriers, such as tight muscles, stiff muscles, spasticity, abnormal movement patterns. Those are all things that kind of resist a normal movement pattern. So when you're working on normal movement patterns after a stroke, it might not be the most efficient movement pattern because you're working against all of these other barriers. And that is where this question kind of fits into this question. Often my movement, especially with new movements, doesn't feel great. So there's two things to consider, that when you are working on normalizing movement patterns, it might not feel great because it's not as efficient as the just doing your compensatory patterns. So compensatory patterns might be more efficient and might feel more normal, especially if you have what we call learned non-use, which I've done full videos on that, but that's just basically with right after a stroke or a brain injury, when you can't move a limb, you just don't move it, and then the brain kind of learns that that arm doesn't move, and then it further ingrains that non-moving arm pattern kind of deep into the hardware of your brain. So that's learned non-use. So because you're kind of now possibly even fighting some of those compensatory patterns when you're working on normalizing movement patterns, it might not feel great, and it might not be the easiest way to get from point A to point B, but I do encourage it, because at the very least you are going to keep the range of motion, so the total motion in that limb. If you don't continue to work on normalizing movement patterns, you're going to lose range of motion, so eventually you won't even be able to help the involved arm to reach overhead. So that's one reason why I think it's important. The other reason I think it's important is we know that the brain is always building new neural networks. Now, as we age, it's not as efficient, but we know that our brain can continue to develop new neural networks well into late adulthood. So I think there's always potential to relearn a movement pattern. So I feel like there should be some component to work on normalizing movement patterns 5, even 10 years into your recovery. And then if you do choose to go down this road of continuing to work on normalizing movement patterns, then I would say pay attention to not focusing so much on how a movement feels, and maybe just occasionally having someone videotape you or looking in a mirror and paying more attention to how does it look. Is it starting to look more normal versus today it feels like it's harder or it feels really stiff, because that could be very discouraging because our feelings change day to day. So maybe focusing more on what it looks like, or having a target with a movement, like I'm going to reach my arm up to shoulder height without my elbow going out to the side. Like have a target and say, okay, well, I hit that target and my elbow didn't go out to the side. Create something that might be a little bit more measurable other than the way you feel. Those would be my suggestions, and that's kind of a long answer to when I use the word quality movement, I'm kind of having all of these other kind of mini thoughts kind of working in the background. So excellent question. Thank you so much for that question, and I'm so sorry I've never actually explained what I mean by that word in the past. If you liked that video, check out these 2 videos down here. If you want even more support or ideas on how to improve your overall health and movement quality, check out our Gold membership program. As a member of that program, you will get access to over 300 exercises that are not here on YouTube, as well as access to our monthly live Q&A where you can get your specific questions answered. I enjoyed spending time with you all today, and I will see you here on YouTube in the next video.